And welcome back to the Morning X. Over 300,000 women had breast augmentation surgery last year. The procedure has changed over the years. The newest, leaving you scar-free. Here with all the details from the Plastic Surgery Group, Dr. Williams. Welcome to the Morning X. Good to see you.
Thanks for having me.
Okay, so tell us about this procedure. And you said it's not relatively new.
No. Over the last 10 or 15 years, plastic surgeons have been looking for procedures that we can do through smaller scars, less invasive, hopefully improving our results. There has been some application in facial cosmetic surgery with respect to endoscopic procedures, and breast augmentation similarly has enjoyed some popularity with endoscopic procedures. General surgeons and gynecologists typically have had a lot of notoriety about improving their results and offering the opportunity for patients to have, gallbladders and procedures such as that on an outpatient basis. So using those same instruments, we're able to provide, I think, a better experience for some of our procedures today.
And it is really interesting. If we could take a look at some of the pictures, we have some pictures up of 2 months post-op, 4 and 6, and by the time, and this is actually done under the arm.
That's correct. As you can see, this scar tends to be, it's well concealed, obviously, and there tends to be some interest in women who are good candidates for endoscopic procedures, obviously, to have this type of a scar. That's not to say that the scars on the breast that we have offered over the years with traditional breast augmentation are much more noticeable, but clearly this tends to be an advantage for many women.
Sure. And who is the best candidate for something like this, for this particular procedure?
Well, in my opinion, I think that women who have very good symmetry, very good balance to the breast, women who do not have developmental problems typically are great candidates for this procedure. Obviously, I'd like to see a patient be a good candidate for a saline breast augmentation as well. I think that the traditional incisions for silicone gel augmentation still are probably best utilized for gel augmentation.
Is the recovery time different than the traditional breast augmentation surgery that you're doing, or is it similar?
It's similar. I usually tell patients they're looking at about 2 to 3 days of pain pills and 2 to 3 days of getting off pain pills, so that by postoperative day 5 or 6, they're typically back to most of their activities of daily living. Not to say that there's not some soreness and discomfort that can occur with exercise and greater mobility, but clearly by postoperative day 5 or 6, they're doing pretty well.
Are there any additional risks in this particular procedure than others?
Not significantly. We obviously are looking at all of our breast augmentations in terms of the risks of not only scarring, but we're looking at risks of swelling and abnormal collections of blood and placement of the implants to be accurate and perfect. And so there really isn't a significant advantage with this approach. The approach basically offers us almost a scarless incision.
That's interesting. Thank you so much.
Okay.
Thanks, Dr. Williams.
Well, thanks for having us.